As we work our way through these 26 actionable steps that were outlined in the book, The Parkinson's Plan, I think it's time that we pause just a minute and kind of point some very important things out. Now, this is an excellent book, and I do feel like it is one that everybody should know about and have access to because it's about hope and it's about outlining multiple things that we can do to put ourselves in a better situation. Now, recently, I got a wonderful comment from a gentleman on one of the videos I made specifically about golfing, and I had a feeling I would get some pushback from the golfing community on this. Now, I don't know this, but this gentleman is from Florida, and I know there's a lot of golfing down there. But he said, because we were talking about the risks of the pesticides being sprayed at the golf courses, and he said, if this is true, most professional golfers and people who work on golf courses would have Parkinson's. Now, I genuinely appreciate that pushback because questioning simple explanations is good science. But here's the truth. Chronic diseases like Parkinson's are not caused by one exposure, one job, or one chemical. They are cumulative, contextual, and biological. Now, I'm a holistic nutritionist, and I've been practicing clinically for many, many years. And this is kind of the crux of what we do when we look at things from a holistic standpoint. We have to look at so many different variables. We have to look at the variables that are contributing to the destruction of the human and those variables that are missing that would contribute to the healing of that person. And context is very, very important. And the accumulation of certain aspects is also very important. Now, these are very difficult things to be able to keep an eye on when we're talking about these types of conditions. But the risk is shaped by many, many variables. It could also be genetics or detox capacity or gut health or nutrition. It could be immune function, chemical burdens, inflammation, stress physiology, your microbiome's health, head trauma, environmental load. So two people can have the same exposure and completely different outcomes because the internal terrain is different. So this isn't saying golf courses cause Parkinson's or not wearing PPE, as we're going to go into, will cause Parkinson's. It's about understanding that certain exposures can unmask vulnerability in a system that's already under strain. So this is correlative. It's not simplistic causation because biology isn't linear. It's layered. It's adaptive. It's very human. I was just preparing for an upcoming seminar that I'm sharing with a colleague of mine, Dr. Crippen, and I found these two slides very important. I wanted to share these two thoughts in this video because they're very appropriate to this. The first is a quote from Hippocrates saying, it is important to know, it's more important to know what sort of person has a disease than to know what sort of disease a person has. I think that is worth repeating when we really thinking about these very complex conditions like Parkinson's. And the other one was a quote from D.D. Palmer. My friend, Dr. Jeff Crippen, is a chiropractor. And that quote is, I desired to know why one person was ailing and his associate eating at the same table, working in the same shop, the same bench, was not. Because there's so many variables, and we have to keep that in mind. The Parkinson's Plan is helping us identify many of these contributing factors or potential variables that we have to be mindful of. That's why there's 26 just in this book. And this is exactly why PPE or personal protective equipment matters, because we don't always know which exposure becomes the tipping point for which the body is going to start to express certain things. And PPE is not an active, not just, it is an active prevention. It's not something to be wearing out of fear. We often ignore what doesn't harm us immediately. That's why it's important. And I see this all the time in so many different conditions. People don't realize that something is happening under the surface because they don't feel something painful immediately. And I would always say that if somebody could feel the pain of their actions immediately from eating poorly or eating things that are contributing to their demise ultimately, they would stop doing it immediately. And this is what happens now. We normalize exposures. We adapt to the risk and we become lax, not because we don't care, but because the danger doesn't feel so imminent. It feels abstract. So PPE or personal protective equipment isn't about fear. It's about respecting the body's limits. It's about long-term protection. And it's about preserving health before damage accumulates. Okay, so this is why the 20th step in the book, The Parkinson's Plan, the action step, is very powerful and often overlooked to use your personal protective equipment. And that helps the body be protected from toxic effects of lots of chemicals. And this can include something simple like long sleeves and pants, gloves, goggles, masks, and respirators. So these protections matter, especially for farmers, landscapers, pesticide applicators, industrial workers, and anyone who is exposed to chemicals like TCEs and PCEs. So if you are an employer of individuals, please protect your workers by providing proper PPE. I'll get there eventually. And if you are a worker, use it every time. Okay, not because harm is always immediate, because the damage is cumulative and invisible until it is too late. So this is why we're sending these videos out, is to remind people that there's multiple things that you could be doing to keep that accumulation from becoming something that overwhelms. That's the whole idea. And if it's spending time on a golf course, you can reduce that accumulation by being mindful of the water and being mindful of the days that those pesticides are being sprayed, as I went over in the video. Perhaps some of those golfers who do wind up having these conditions are golfing on the day it's getting sprayed a lot more than they're not. I don't know. There's too many variables to really say. But the whole point of this is to help understand that there are many things that do add up over a long period of time that we're not aware of. And that's what we're trying to bring awareness to all of you about these could be. We've got 6 more to go, and I really appreciate that feedback. It's a very important point for us to talk about, and I look forward to more of your feedback and pushback. Like I said, I'm not above being corrected. I enjoy when people point out something that may be a blind spot of mine, because it doesn't serve me or any of the people that I'm serving to operate in that blind spot. I want there to be light shed on where I may be saying something that isn't exactly going to be supportive and helpful. And I'm not going to always get it right, but I'm going to do my best, and I'm going to share as much as I can with all of you so that you have the options and the awareness to make the choices for yourself and for your loved ones. Thanks for watching.